Ever feel like there's this like invisible wall between you and the healthcare you need?
Oh, yeah.
Like you're stuck waiting for permission just to start feeling better?
Yeah, definitely.
We're diving into that today.
Yeah.
The world of prior authorization,
All right.
it can be so confusing and
Yeah,
frustrating for patients.
definitely.
Basically,
Yeah.
your insurance company wants to double check
Uh-huh.
that the treatment your doctor recommends
Yep.
is,
Right.
in line with their guidelines
But
and
don't.
of course their budget.
Oh, yeah, of course.
And recently there's been a ton of news about prior authorization,
Oh, really?
like new tech coming out,
Okay.
but also concerns about how it's being used.
Interesting.
So we're going to break it all down today,
Sounds good.
see what it all means for you.
All right.
Basically, three main areas.
Okay.
First, we'll look at how automation and AI
Mm.
are like shaking things up,
Oh,
promising faster approvals and less paperwork.
that's great.
Then we'll talk about the concerns
Yeah.
about potential overuse and denials,
Yeah.
especially for post-acute care.
Okay.
The care you need after a hospital stay,
Oh, right.
like rehab and skilled nursing facilities. And then finally,
Yeah.
we'll look at some research about potential racial disparities
Interesting.
in the prior authorization process.
Okay. Yeah. Let's get into it.
So let's start with some good news.
Okay.
The tech revolution.
All right.
It's coming to prior authorization.
Oh, wow.
Optum Rx and SureScripts,
Mm-hmm.
they've been making headlines
Oh, yeah.
with this new automated system
Hmm.
that's boasting approval times under 30 seconds.
Under 30 seconds.
Yeah,
Wow, that's amazing.
I know, right?
Yeah.
Think about how long it usually takes.
Oh, I know. It's like days, sometimes weeks.
Even weeks sometimes.
Ugh, it's awful.
This new system,
Yeah.
it uses data that's already in your electronic medical records
Okay.
to automatically populate and analyze
Mm.
authorization requests against the clinical guidelines.
Right.
So if everything checks out,
Yeah.
bam, instant approval.
That's incredible.
It's huge for doctors.
Oh, yeah.
They spend so much
So
time
much time.
dealing with paperwork.
I know, it's crazy.
Not to mention the patients who
Right.
can now start treatment sooner.
Exactly.
And pharmacists, too.
Oh, right.
They're often caught in the middle of this.
Definitely.
Faster approvals mean they can dispense meds more efficiently
For sure.
and focus more on actual patient care.
Yeah, that's great.
And the results from their pilot program
Mm-hmm.
at Cleveland Clinic and other health systems
Yeah,
are pretty impressive.
it's here.
88% reduction in appeals
Wow.
and a 68% decrease in denials due to missing information.
Seriously. That's huge.
It's massive.
Yeah.
So it seems like this kind of technology
Yeah.
could really streamline the process
That's what it sounds like.
and take away some of the headaches.
Hopefully, yeah.
But Optum Rx isn't the only one doing this.
Right.
Blue Shield of California,
Okay.
they're partnering with Salesforce
Interesting.
to build a similar system
Mhm.
with an even bolder goal.
Okay. What's that?
They want to make prior authorization as easy as using your credit card.
No way.
I know, right?
Wow.
No more phone calls.
One more faxes.
No faxes.
That's the dream.
Mountains of paperwork gone.
Wow.
Just like swift, seamless approvals.
That sounds amazing.
I know
Okay.
there is a catch. It's still in development.
Okay.
Testing starts in 2025
Right.
and full rollouts planned for 2026.
Gotcha. So we have to wait a bit.
Yeah, a little while.
Yeah,
But it's something to keep an eye on.
definitely.
But while this idea of instant approvals is exciting,
Yeah.
it's important to acknowledge
Mm-hmm.
that there are concerns
Okay.
about how prior authorization is being used,
Right.
even with all this new tech.
I see what you mean.
Like automation might make things faster,
Uh-huh.
but it doesn't actually solve the underlying issues.
Good point.
A recent Senate report,
Okay.
they investigated some big names in insurance.
Yeah.
United Healthcare, Humana, CVS.
Okay. Big players.
And what they found was kind of troubling.
What was it?
They highlighted really high denial rates
Oh, no.
for prior authorization requests.
For real?
Yeah.
Wow.
Especially for post-acute care services.
That's concerning.
And when you're talking about recovery after a hospital stay,
Right.
those denials can have a huge impact.
Yes, absolutely.
Humana, for example,
Mm-hmm.
their denial rate for post-acute care requests
Yeah.
was more than 16 times higher.
16 times.
16
Ah,
than their overall denial rate in 2022.
that's a big difference.
Huge.
Yeah.
Makes you wonder
Right.
about what criteria they're using.
Yeah. Are they really looking at medical necessity?
Like, is it really about medical need?
Or is it more about...
Or are other factors,
Yeah.
like cost,
Mm-hmm.
playing a bigger role?
Yeah. That's a worry.
Because denying necessary post-acute care.
Right.
That could lead to complications,
Oh, for sure.
readmissions,
Mm-hmm.
even longer recovery times.
Yeah, that's a big concern.
It is.
Yeah. Yeah, it's like we're trying to balance all this amazing tech
Right.
with,
Yeah,
making sure it's being used ethically.
exactly. And speaking of ethical considerations,
Uh-huh.
let's talk about another area where prior authorization
Mm-hmm.
is raising some red flags.
Okay.
Potential racial
Oh,
disparities.
wow. Yeah, that's a big
A
one.
recent study.
Okay.
It was published in the American Journal of Managed Care.
Mm-hmm.
They looked at prior authorization for cancer patients,
Okay.
and they were looking for any disparities
Right.
across different racial and ethnic groups.
Makes sense because everyone deserves
Right.
timely access to cancer care,
Absolutely.
regardless of their background.
Exactly. So what did they find?
Well, it was interesting.
Okay.
There weren't any significant differences
Huh.
in approval or denial rates for Black and Hispanic patients compared to white patients.
So those groups were pretty much the same.
Yeah, but Asian patients actually had faster approvals
Oh, really?
and lower denial rates.
Interesting. So it seems like
Yeah,
things are fairly equitable for some groups,
right.
but this difference for Asian patients,
Yeah,
it definitely raises some questions.
absolutely. Like, what could be causing that?
Right. Is it that they tend to require less costly treatments?
Maybe. Or are their doctors just better at navigating the system?
Could be. Or are there
Right.
like cultural factors at play?
It's possible.
These are all questions that need more research.
Yeah, we need to figure out
Right.
what's really going on.
Because if there is some kind of systemic bias,
Yeah.
even unintentional,
Mm-hmm.
that's a huge problem.
Definitely highlights the need to understand
Yes.
how different cultural nuances might be influencing things.
And ultimately affecting those outcomes.
Exactly.
You know, we've talked about some pretty heavy stuff today.
Yeah.
Overuse, denials, disparities.
It can be a bit overwhelming.
It's easy to focus on the negative,
Right.
but let's not forget about that incredible potential
Yeah.
of these new technologies.
Like that Optum Rx thing?
Exactly. It's
Yeah.
remarkable.
It really is.
It's not just about speed either.
Right. It's about empowering
Yeah.
both patients and providers.
Imagine walking out of the doctor's office
Yeah.
with the medication you need.
Right.
No more waiting
No more worry.
for days or weeks.
Exactly. It could totally change the patient experience.
Like alleviate so much stress
Oh, yeah.
and potentially even lead to better health outcomes.
Definitely, because people can start treatment right away.
And what about the impact on doctors?
Oh, yeah. Good point.
Freeing them up from all that paperwork.
Seriously, imagine all that extra time.
They could see more patients,
Right.
focus on preventative care,
Yeah.
have more in-depth conversations with their patients.
The possibilities are endless.
It's pretty exciting.
It is.
And then there's Blue Shield of California.
Right, with their credit card idea.
I know it sounds almost too good to be true.
We'll have to see if they can pull it off.
For sure.
But it's great that they're even trying.
It shows the potential is there.
Absolutely.
I'm curious about the tech behind all of this.
Me too.
Yeah.
Like, how does it actually work?
What's making this kind of seamless experience possible?
From what I understand, it's a combination of things.
Okay.
Cloud computing AI
Uh-huh.
and some pretty sophisticated algorithms.
So it's not just automation.
Right.
It's like intelligent automation.
Exactly.
It's using tech to speed things up,
Mm-hmm.
but also to analyze data,
Yeah.
make decisions in real time.
And hopefully more accurate decisions.
Right. And those results from the Cleveland Clinic,
Yeah.
they suggest that it's actually working.
Those numbers were impressive.
88% reduction in appeals,
Yeah.
68% fewer denials.
It's pretty amazing.
It feels like we're on the verge of something big.
It does feel like a turning point.
Yeah. Technology is just one piece of the puzzle.
Right. It's a tool.
Exactly.
And like any tool,
You can be used for good or bad.
we need to be careful
Make sure it's implemented responsibly
with safeguards in place
and ethically.
so we don't create more problems.
Right. Because technology should be there
Yeah.
to enhance the patient experience,
Improve access to care
not create new barriers.
or make existing inequities even worse.
And that brings us back
Yeah.
to the human element.
Right. We can't forget about the people.
Even with the most advanced technology,
Yeah.
healthcare is ultimately about people,
It's about caring for individuals,
understanding their needs.
advocating for them.
And that requires Empathy,
compassion,
critical thinking.
ethical decision-making.
We can't just hand everything over to algorithms
Right.
and wash our hands of it.
We need human oversight.
Transparency.
Accountability. It really is all about finding that balance.
Right. Using tech to help people,
Exactly.
not replace them.
Yeah, so what can our listeners do with all this information?
Yeah, what can they do?
Well, first of all, don't be afraid to ask questions.
Like, if your doctor recommends a treatment that needs prior authorization,
Yeah, find out why.
why does it need it?
What are the criteria they're using?
What happens if it's denied?
What are my options?
Exactly, it's your health.
You have a right to be involved.
And as these new technologies come out,
Stay informed.
ask your providers.
Ask your insurance company.
Are they using these faster systems?
Because who wants to deal with the old way?
Nobody.
If there's a chance to avoid all that hassle,
The paperwork, the phone calls,
take it.
and don't underestimate the power of your own experiences.
Share them,
Talk about it.
good or bad.
Let people know what you went through.
Tell policymakers,
Patient advocacy groups.
anyone who can help make a difference.
Because those personal stories,
They really make an impact.
they put a human face on these issues.
Way more than any statistic.
Here's something to think about. We talk a lot about balancing cost control with patient access.
Right, making sure everyone gets the care they need.
But what if we thought about it differently?
How do you mean?
What if instead of fighting over treatments,
Yeah.
we invested more in preventing those conditions in the first place?
Oh, wow, prevention.
Prevention.
That's a good point.
If we focused on wellness,
Healthier lifestyles.
early detection.
Wouldn't that mean we need fewer expensive treatments later on?
Exactly.
It's a big question.
It is.
But worth thinking about.
Could shifting to preventative care
Actually reduce those prior authorization battles.
maybe even lead to a better healthcare system overall?
A more sustainable system.
One that's truly focused on the patient.
That's the goal.
So that's our deep dive on prior authorization,
We covered a lot.
the challenges, the innovations, and the hope for the future.
It's an ever-changing landscape.
So stay informed,
Stay curious.
and most importantly, stay well.